Welcome to RSCP. My name is Ben Brendamore, and I'll be discussing what interventional radiologists do. So interventional radiology is a rapidly growing high-tech field of medicine that uses minimally invasive procedures instead of surgery to treat a variety of conditions. Compared to open surgery, interventional radiology procedures generally involve less pain, reduce risk of complications like infection, bleeding, damage to surrounding structures, and shorten hospital stays. Many interventional radiology procedures are started by inserting a very small needle, wires, and catheters and sheaths into arteries and veins. Through just a tiny incision, no larger than a few millimeters, they can reach essentially every organ in the body and perform a procedure. One of the coolest things about the specialty is they interact with almost every other specialty in medicine and do procedures across multiple organ systems of the body. As an interventional radiologist, you'll be interacting with your hepatology and HPB surgery colleagues, taking care of patients with liver cancer through microwave ablations, transarterial chemoembolization or TACE, also Y90 as well. You'll also be taking care of patients with variceal bleeds and from cirrhosis and be called in for TIPS procedures as well. As an interventional radiologist, you will also be spending a lot of time working with your urology and nephrology colleagues, doing procedures such as ureteral stenting, placing percutaneous nephrostomy tubes in patients with hydronephrosis, performing prostate artery embolizations on patients with BPH, doing all sorts of ablations on renal cancers, as well as a newer procedure called endovascular AV fistula creation. There's also a lot of overlap with vascular surgery. You can perform ambulatory phlebectomy and carotid artery stenting, as well as working with patients with peripheral arterial disease, vascular malformations. And just to go through some of the other specialties in medicine that you interact with through interventional radiology on a weekly or monthly basis, you can interact with OB-GYN, treating patients with pelvic congestion syndrome, treating patients with symptomatic uterine fibroids with a procedure called uterine fibroid embolization, also in the management of patients with postpartum hemorrhage. You can work with your hematology colleagues doing bone marrow biopsies, placing and removing IVC filters, and performing thoracic duct embolizations. You can work with pulmonology, doing procedures such as bronchial artery embolizations or lung biopsies, also in the management of PEs. You can work with your GI colleagues doing G and GJ tube placements, managing GI bleeds and doing hemorrhoid embolizations. You can work with the musculoskeletal system doing kyphoplasties. You can work with neurology or neurosurgery, doing endovascular coiling of brain aneurysms and the management of stroke and doing LPs. You can work with endocrinology, doing adrenal vein sampling, as well as many other specialties like bariatrics, trauma, oncology. The field of interventional oncology is rapidly growing, and then general surgery as well. This is a great photo that wraps up how diverse and broad interventional radiology is. You are truly working on the entire body across every organ system in the body. If IR is something you find yourself interested in, there's multiple different routes you can take to get there. The first route is a newer one called the Integrated IR Residency. This you apply to straight out of medical school. It consists of an internship. Many schools require this to be a surgical internship. However, other schools will allow you to choose whether you do a surgical, medicine, or transitional year. Then, as you get into your radiology training, your first 3 years mainly consist of diagnostic radiology training, and then your last 2 years are mainly IR training for a total of 6 years. For the traditional pathway, it's no longer offered anymore. The independent IR residency, you complete a diagnostic radiology residency, and then at the completion of that, you do a 2-year IR residency training that can be at the same school or a different school for a total of 7 years. And then the last pathway is to apply to a diagnostic radiology program that has ESIR, and during your second year of DR training, you choose to early specialize in IR, and you complete 12 IR rotations throughout the rest of your DR training. And then at the completion of that, you do a 1 year of IR training, and this can be at the same institution or a different institution, and that's also a total of 6 years.